Hi, I'm Maya, and I was assigned Down syndrome. So, Down syndrome is also called trisomy 21. It's caused by an error in cell division called non disjunction that results in an extra copy of chromosome 21. This means that a person has three copies of chromosome 21 instead of the usual two. The extra chromosome 21 is in all cells of the body. This error occurs randomly during the formation of an egg or sperm, and there are no behavioral activity or environmental factors that are known to cause trisomy 21. Characteristics and common symptoms. Children have characteristic features such as slanted eyes, skin fold over the nasal corners of the eyes, nasal flat bridge, and a protruding tongue common. Also throughout their body, and they have simian creases in their hands. Impact on development. Children take longer to reach developmental milestones such as sitting, talking, and walking, and mild to moderate intellectual disability is common. Functional implications. So there's a need for earlier intervention. So physical therapy, occupational therapy, speech therapy can all help improve outcomes in various areas. For ADLs, there's a delay in self-care. So they need support with hygiene, dressing, and feeding. IADLs may require supervision for safety awareness and structured support. Sorry, safety awareness and meal prep. Education is they have a slower learning pace, so they benefit from visual and structured support. For communication, there's speech delays and expressive language challenges. For social participation, they're sociable but may have difficulty with social cues and understanding boundaries. And sleep apnea is common and that can affect daily functioning. For educational support, classroom accommodations may be needed to support learning, such as visual aids, modified curriculum, and extra time. And adaptive strategies are needed in support of ADLs, so dressing, eating, and self care. How does this affect the child's occupation? Children with Down syndrome can fully participate in meaningful occupations, but they often need adaptations, extra time, and support. ADLs and IADLs are delayed and come with challenges. They have a slower learning pace, so they're slower in academic settings, and they have delays in play and leisure and sleep problems, as I mentioned before. Specific considerations for occupational therapy. It should really focus on building the child's ability to participate in daily activities and meaningful occupations, so motor development, communication, self care, and social participation. It should focus on visual supports, routine and repetition, adaptive tools, interdisciplinary collaboration, and the at risk medical issues need to be monitored. So, the medical problems are congenital heart defect, duodenal atresia, hypothyroidism, hearing and vision impairment, increased risk of developing leukemia, vertebral C1 and C2 instability, sleep apnea, overweight, Alzheimer's disease, early onset dementia, depression, anxiety, ADHD, and autism. They should address the low muscle tone, fine motor skill development, self care skills, sensory processing, cognitive and social skills, school performance skills, and family education and support. And that is all.